Morning, good afternoon, good evening, everybody, and thank you for joining us today. Again, thank you for joining us today for this critical conversation as part of our webinar series on the WFOT Global Workforce Strategy. My name is Richard Ledyard, the WFOT Executive Director, and I'm honoured to welcome such an engaged and diverse group of professionals to this session. The session is being recorded and will be made available later. Today's focus is on leadership, advocacy, and policy for workforce planning, an area central to ensuring the sustainability and growth of the occupational therapy workforce. As global challenges in health and social care continue to evolve, so must we as leaders and advocates. This session aims to equip you with insights and tools necessary to strengthen our collective impact. Our programme today will cover a range of topics that highlight how leadership, strategic advocacy, and forward thinking policy shape the future of occupational therapy worldwide. You'll hear from a distinguished panel of speakers who will bring a wealth of expertise and real world experience to this conversation. You'll hear from Tiago Jesus, Workforce Strategy Project Lead, who'll delve into leadership, advocacy, and policy as vital components of workforce planning. Claudia von Speck, WFOT Professional Advisor, will share initiatives from WFOT designed to support leadership and advocacy efforts globally. Alawani Manenje, President of the Occupational Therapy Association of South Africa, will discuss the role of advocacy in achieving universal health coverage. Dae Kang, the delegate from the Korean Association of Occupational Therapists, will highlight successful advocacy efforts to include occupational therapists in mental health policy. And finally, Samantha Shan, WFOT President, will bring it all together by exploring WFOT's role in the global context. This session is part of a broader effort to equip occupational therapy communities and stakeholders with the tools to lead and advocate effectively. Whether you're here to learn, contribute, or connect, your participation today is essential to the success of this global initiative. Please use the question and answer function to ask any questions. We'll aim to respond to all the questions raised following the session and post them online following the webinar. So let's start and learn how we can collectively lead and advocate for a stronger, more resilient occupational therapy workforce. I'll now hand over to Tiago Jesus, WFOT Workforce Strategy Project Lead, to begin the session. Thank you, Tiago.
So thank you very much, Richard, for your introduction. So yes, my name is Tiago Jesus. I'm an assistant professor of occupational therapy at the Ohio State University, as well as a project lead for the development of this global OT workforce strategy. So the agenda for today is that we're going to provide just some 3 minutes of context and previous development of what this broad strategy is, and then a little bit of why this workforce leadership is a topic for today, and about the strategy itself on this element of building workforce leadership and planning capacity. And that's the agenda for today. So, context and previous developments. So this global workforce strategy provides a little bit of some context. This overall webinar series is framed in that context of that strategy that is available on the WFOT's website, including in an interactive format alongside with an workforce hub. So I would invite you then to visit all those resources. So what the strategy is and what the strategy is not. The strategy, it's a global framework that articulates key strategic directions to guide the development of the workforce development within and across jurisdictions. And it's important to note that the strategy is not an action plan. Although providing strategic guidance, it will not determine who's going to do what, where, how, and who pays for it, and it's not within each context, because we understand that that's necessarily a locally owned process, and that's the reason why we need to have empowered occupational therapy leaders that are willing and capable of igniting or running that process, and that's the part of the reason why this is an important topic for today. So just a little bit of background about the structure of the strategy. This is the figure with overall 7 strategic directions. And then within each of those, we have an overall problem, an overall aim, the problem and the opportunity that led to that strategy, long-term and short-term goals for that strategy, specific guidance for action, examples of tasks on possible ways to personalize those directions. And it's important to remember that this did not come from the back of our minds. So that was the result of a long process, 10-step process that involved scoping reviews, SWOT analysis, an advisory group, and then various levels of consultation with WFOT member organization representatives until we were able to come to launch this strategy. And you are able to, this is not our first webinar, this is our second webinar, and you are welcome to visit or to watch the recorded presentation of the first webinar on the overall overview of this global strategy to learn a little bit more about that. So the topic for today is workforce leadership and why. So this is the figure that we have seen before, but here we are going to focus on this particular component. So building workforce leadership planning capacity. So among those 7 strategies, we start this webinar specifically on that 7th strategy. And the question is why? So, well, national and local strategy development requires agency from occupational therapy workforce leaders. These are necessarily local, national, regional leaders with context-sensitive knowledge of what is happening in that context, which we and the strategy don't have. And those leaders need to be enabled on their workforce knowledge, skills, and guidance. And that is what the strategy can help provide. And some WFOT resources as well. Finally, leadership is needed to help integrate all other strategies. So that's a good starting point to start with that leadership level. And developing strong leaders is key to advancing the workforce strategies. So overall, I can synthesize the whole thing in this overall need to empowering leaders of change. So in addition to what the strategy in the workforce hub can provide, the own WFOT has been developing some tools and resources on leadership and advocacy for change. Calder will be speaking about that a little bit today. Also, we have some national level presentations that are going to provide some examples of deployment of that leadership and advocacy activities at the national level. And I think together, these are important resources for empowering occupational therapy workforce leaders in their task of locally extracting the occupational therapy workforce. So the strategy in a nutshell, just about 3 slides about what we were envisioning with that. So there are kind of 3 strategic directions within that strategy itself. So the first of which, it's about occupational therapy specific developments. And I'm speaking just about the goals, not the strategy itself, but the goals provide the direction. So we envision that occupational therapy workforce leaders can foster profession-specific situation analysis and workforce strengthening plans. For a short-term goal, this may include profession-specific databases and participatory situation analysis being initiated and completed by those leaders, followed by some action planning. And as a long-term goal for that, we envision that national situation assessments and action planning are in place and result in significant documented developments of the occupational therapy workforce, and being its expansion or improvement population access for it. And then a little bit of a cross-professional development goal is that we will be able to eventually see occupational therapy workforce leaders continuously help develop and evaluate cross-professional health workforce development plans and policies. And in that regard, the occupational therapy workforce leaders might be active participants, so sit at a table, provide database contributions in cross-professional health workforce developments at their local, national, and international level. And then as a long-term goal, these cross-professional health workforce plans and activities might explicitly target occupational therapists within their broader set of goals and activities. So I advanced one slide. So finally, there is a need to build the underlying capacity for that. So we need to develop the workforce capacity and leadership in terms of development development programs for the future and current occupational therapy workforce and their leaders, including emergent leaders from low and middle income countries. And that might entail the use of data and evidence on occupational therapy workforce gaps and solutions to contribute to developing context-appropriate, policy-relevant occupational therapy workforce research questions, and to use workforce knowledge tools and frameworks for both the profession-specific and cross-professional developments. And that may even be included in the curriculum of high-level training and education programs for occupational therapy that might increasingly have workforce frameworks, developments, and tools. And to leverage the leadership and advocacy resources and tools, including those from the framework, from the WFOT that Claudia is going to speak a little bit more about in the next presentation. So thank you very much for listening to me today.
Thank you, Tiago. Thank you, Tiago, for that insightful presentation on the critical role of leadership and advocacy in policy and workforce planning. Tiago highlighted how these elements are the foundation of WFOT's global workforce strategy, ensuring we not only address the current challenges, but also prepare for future demands. Now it's my pleasure to introduce our next speaker, Claudia von Svett, WFOT Professional Advisor. Claudia will share WFOT's leadership and advocacy initiatives, offering practical insights and examples of how these efforts are driving meaningful change in occupational therapy practice worldwide. Over to you, Claudia, and thank you.
Thank you very much, Richard. In this presentation today, I'd like to introduce the resources that are available from WFOT to assist with advocacy and leadership roles, as well as provide some examples of advocacy initiatives of the Federation. So, as Tiago has explained, the priority 7 of the workforce strategy involves building leadership capacity, and that provides the context for today's presentation. Advocacy is an important and necessary part of influencing decision makers to address occupational therapy workforce issues by actions such as changing policy or practices or providing funding. The WFOT advocacy strategy outlines activities and resources of the Federation that can be used to build capacity for advocacy and leadership in workforce planning. And the advocacy strategy and the resources that I discussed today are available on the WFOT website. The first element of the advocacy strategy is to identify key issues. And as Diego has explained in his presentation, that for each element or for each strategic priority in the global strategy, we've identified the key issues. And they can be, that we feel can be addressed at the local and national level. And also, Diego explained a little bit about some of the ideas that we have around some of the strategic directions for the advocacy issues. And I guess it's important to note that although we've identified these goals and actions, that we're not expecting that all local groups are going to undertake these actions. The suggested actions only really act as a starting point for defining an advocacy strategy that could be implemented. And it's really important that the needs and the local context of the advocacy issue must always be considered first when deciding upon your actions. So WFOT offers a number of resources for developing leadership advocacy knowledge and skills. Such resources include free online videos that introduce important elements of successful advocacy and as well describe the advocacy process. Also available from WFOT are narratives that were submitted by WFOT members that provide successful examples of past occupational therapy initiatives that influence change. For example, there's one narrative that provides a description of how occupational therapists influence government policy in Norway to ensure municipal funding for occupational therapy services that are provided in the community. The narratives explain each step in the advocacy process and emphasize some of the lessons learned in that process. So there are a number of different tools and tactics that may be used when advocating for improved access to occupational therapy. WFOT has several tools on the website that may be used as examples for developing your own advocacy messages and communication methods. For example, we offer template letters for setting up and following up with meetings with people you may wish to influence, as well as we have a guidance document for writing media releases. We also publish position statements, public statements, and have information about occupational therapy that may support your advocacy messages. To support advocacy for the development of the occupational therapy profession, WFOT offers guides from our website regarding how to develop occupational therapy services and occupational therapy entry-level education programs. WFOT also offers the minimum standards for the education of occupational therapists and the education approval process to empower the profession to advocate for quality occupational therapy education. WFOT collaborates and builds partnerships with advocacy groups and a range of other organizations who share mutual goals and have overlapping interests. For example, WFOT has been in official relations with the World Health Organization since 1959. We're working with the World Health Organization on a number of initiatives related to workforce, particularly to improve the global development of rehabilitation services. Involvement with the World Rehabilitation Alliance is a more recent partnership for WFOT for advocacy initiatives, particularly related to improving access to rehabilitation. In advocating for improved occupational therapy access, building such alliances is recommended to amplify advocacy efforts, leverage resources, and increase visibility and influence. The last component of the advocacy strategy involves the implementation of planned advocacy strategies and tactics. WFOT engages in various methods to communicate our advocacy messages, either as an individual organization or usually in partnership with our members or with peer organizations. Advocacy activities include meeting with policymakers, legislators, or government agencies, providing letters of support and submitting statements to influence decision-making. For example, our submissions to the meetings of the World Health Assembly. Such WFOT statements are available on the WFOT website and can be referenced for advocacy efforts at the national and local level. So thank you very much for your attention, and please let us know in the Q&A box if you have any questions. Thanks so much.
Thank you, Claudia, for your presentation on WFOT's leadership and advocacy initiatives, and emphasizing how these initiatives are designed to empower occupational therapists globally by fostering professional development, supporting advocacy efforts, and building leadership capacity. Next, we're honoured to welcome Alawani Manenje, President of the Occupational Therapy Association of South Africa. Alawani will discuss the vital role of advocacy in advancing universal health coverage with a focus on the South African context. She'll also share valuable insights on how strategic efforts have equipped and help position occupational therapy as a key contributor to achieving equitable healthcare for all. Over to you, Alawani.
Thank you, Richard, and thank you for the opportunity to present on behalf of South Africa. We will share a reflective journey on advocacy during policy reform in South Africa. And what is important for us was defining universal healthcare in the context of what is required to achieve access to a full range of quality health services. And what is defined by the World Health Organization is that universal health coverage means that all people have access to quality healthcare services that they need, when they need them, and without financial hardship. It covers a full continuum of essential health services, from health promotion to prevention, rehabilitation, and palliative care. And you will agree with me that in most economies, focus is on treatment and not so much on the other four. So we focus on treatment and not rehabilitation, palliative care, health promotion, and prevention. Can we please have the next slide, please, Matt? So to give context, South Africa will be celebrating, or OTASA will be celebrating 80 years of service, leadership, and advocacy. And various leaders guided the profession through points of reform which impacted both the workforce and service delivery and impacted on universal healthcare. Initially, we had separate development during the apartheid era. Then we moved to a political transition, which we hoped will bring rationalization of services. We quickly moved on to globalization as South African borders opened and there was migration we saw a lot of people coming in, both as therapists and as well as leaving the country. Whilst we were looking at health and education reform, we actually noted that when we moved from the political system had created a two-tier health system, and we quickly moved towards commercialization of health, resulting in the same two-tier system. And this emphasized the disparities both in terms of economies and in terms of the social status of South Africans. Next slide. So our advocacy points had to focus on what the profession is and its service offering. We realized that we tend to think about occupational therapy and use our language as occupational therapy, so occupational therapy jargon. That does not necessarily, it's not understood by the policy writers and the policy makers. We had to also focus on ensuring that rehabilitation and disability management are included at all levels of care. We tended to be left in the hospital, and we needed to also make sure that at primary healthcare level, rehabilitation and disability management finds expression. Equity and equitable distribution of health resources was another area, especially with our history where we had development. This included looking at human resource, financial resources, and infrastructure. The last aspect that we had to look at, because universal health coverage requires funding, and our government is looking at national health insurance as a funding model. We had to look at what will the NHI implications be when funding is required. How will it impact the private sector and also general funding for occupational therapy? The leadership imperatives that we had to employ included crafting a vision that unifies the needs of a diverse profession, politically, economically, and culturally. We also had to create an authentic brand that OTs can respect and rally behind. And I must admit, we have a very polarized public and private sector, as well as the academic and non-governmental, and we needed to unite all these fraternities to make sure that we have good advocacy, a good advocacy position. What we used a lot of over the different decades was agile leadership. We had to manage the attitude towards transformation within the profession before moving on to society. What this required from us is that we need to assess what is the stance of the profession, and also look at the different aspects that will be brought on by specialized or interest areas. So at times we had to project forward and facilitate policy reform without ignoring or negating the struggles, realities, and aspirations of occupational therapists. Next slide, please. Communication became our biggest strategy. We had to start communicating internally to understand what is the environment within the profession, what are the beliefs, what are the anxieties. We quickly learned that if we communicate internally and we don't engage externally, we miss the opportunity to create beneficial relationships with stakeholders that would then clarify positions. So we looked at national dialogues with OTs, and we would identify critical stakeholders within government and many other entities that would engage occupational therapists and address the concerns that were there. We also had to commit to a vision, exploring opportunities and advocating for the profession without compromising the fields of interest. So from time to time, we would have engagements with regulators, worker unions, and OTASA initiated the creation of an interprofessional endeavor, which is where different associations of people who are in rehabilitation and disability management come together to join forces whilst out going through advocating. We also took opportunity whenever we got space to make parliamentary presentations on key issues that would need to be considered when national health insurance was implemented. And we carried the profession, people with disabilities, and disability management and community reintegration as an integrated strategy that requires consideration before that the national health insurance was put into an act. We were lucky to get an opportunity to engage with provincial authorities and also to participate in the presidential summit on healthcare. What this brought was that we had a direct engagement with policymakers and decision makers. One of the important strategic positions that we took was to ensure that whenever there was an opportunity for appointment, we made sure that occupational therapists were competent, appointed into regulatory and administrative positions to advocate for occupational therapy. Can we go to the next slide? In looking at the integrated advocacy strategy for NHI, as a profession, we prioritize clinical care, research, curriculum and education standards, health funding, staffing, and resource profiling. We needed universities to come on board for us to have graduates who understand universal health coverage as a concept and are able to implement universal health coverage. We also engage with researchers and clinical supervisors, as well as management, to look at whether what we are teaching students and what is being done in the clinical platform relates with where the country is going. When we engaged with clinicians, we realized for the first time that we did not provide standardized services. We had different standards and we had different focus areas in terms of where occupational therapy is. So we challenged ourselves as a profession to identify and make sure that there is an opportunity to create service standards and also a uniform language. And that is the process that we're engaged in right now. We're supporting that with clinical research. We also engaged with regulators and government, and the Department of Health was the most primary point of engagement. And we were very lucky in that we had occupational therapists who are already appointed, and they would give us an indication of how to engage and where to put emphasis. As the Office on Healthcare Standards was created, occupational therapists in the public sector were engaged to develop service standards for occupational therapy, to participate in that process, and also the assessment process. So the standards are being reviewed every 3 years, and that process allows us to have a first-hand input as an association in terms of where it is that we need to put emphasis and what documents we need to support the profession with. What was interesting, and I liked what the previous speaker talked about, is making sure you have allies in different platforms. Normally, we would engage with health funders as disgruntled service providers who are not getting paid. But during the process of advocacy, we realized that some of the challenges that we had, they also had, and we started engaging with them. And in certain instances, we would find that they would create an opportunity for us to present what occupational therapy would require. Let's go to the next slide. The lessons that we learned as a profession is that you need to sit at the decision-making table. And when you get to that decision-making table, there are 3 primary focus areas that you need to bring onto the discussion. The quality of data or information and how relevant it is becomes very primary to whatever discussions will be held. The second issue was we always defined occupational therapy in the way that as occupational therapists we understood it. And we quickly learned that we need to explain it within a medical model where we do not purely fit in. And we had to come up with ways of making sure that those who have to make the decisions make decisions with an understanding of what our services are and how they benefit the country. We learned very quickly that research is time-bound. They wanted research within the last 5 years, and that research had to be country-specific. We learned in that process that most of the research that was available in our country was qualitative, and policymakers were looking for quantitative research. So the adjustment in this process was that universities, clinicians, the association had to come up with a research agenda that allows us to have the right type of research, the correct information, presented in a way that is usable and accessible to the policymakers. And we had to be bold in redefining a common vision for the profession in terms of research and defining services. Can we go to the next slide? One of the senior government employees or officials who was an occupational therapist challenged the executive of OTASA, and he said to us, when you come to government, don't ask and don't tell us that we have excluded you. Rather, show us what your contribution is to the society. And as soon as we did that, we had to now identify how we can resolve important or critical concerns that society had. Also, what are the priorities of government? And we had to quickly define as a profession our position and realize that we hold practical solution to many societal changes. However, the gap is in how we articulate this into the public space. And we realize that most of this information sits within our resources, but it is not where it is needed. Part of the process that as an occupational therapy internationally needs to go through is asserting ourselves as a solution bearer as opposed to an excluded service from the service basket. We realized that when we started coming up with solutions and doing presentations and being in the public space and not focusing on how excluded we feel, inclusion naturally followed our relevance. And perhaps my last message will be that as a profession, we need a uniform language across the world, across countries, and across service areas. Thank you very much, Richard. Doribu.
Thank you so much, Elawani, for that very powerful presentation. Your insights into the role of advocacy in advancing universal health coverage in South Africa are both inspiring and practical. And it's clear that your work has made a significant impact, and we appreciate the strategies you've shared for positioning occupational therapy as an essential part of equitable healthcare. Next, we'll hear from Dae Kang, a delegate from the Korean Association of Occupational Therapists. Dae will share a recorded presentation on advocacy efforts in Korea that has successfully influenced government policy to include occupational therapists in mental health services.
Hello, everyone. This is Dae Kang, WFOT delegate, Korea. Today, I'm going to talk about advocacy process of revised Mental Health Act that includes occupational therapists as mental health care specialists. This graph shows steady increase of occupational therapists, and about 2,000 new occupational therapists are coming out every year. In terms of occupational therapy service provision, based on practicing number of 21,705 occupational therapists as of 2023, total percentage of occupational therapists is less than 1%. Currently, only 200 occupational therapists are working at mental health-related facilities. I have to say that this is closely related to the legal system. The first occupational therapy-related official statement was introduced in a bill called Medical Service Technologists Act in 1965. Article 2 of the Act defined the role of occupational therapist, and problem was it focused on only physical disabilities. Because of the world's physical and functional disorders, occupational therapy services have been limited to only those people with physical disabilities for nearly 50 years. When the Mental Health Act passed the National Assembly in 1995, only nurses, psychologists, and social workers were included as mental health care specialist professions. The reason occupational therapists were excluded from the mental health care specialist was because of Article 2 of the Medical Service Technologists Act. Before the enactment of the Mental Health Act, the Korean Society of Neuropsychiatry had a public hearing on the Mental Health Act under the theme, "Is the Mental Health Act Necessary?" in 1992. The experts at the hearing consensually contended that the mental health care specialist professions should include clinical psychologists, social workers, occupational therapists, and rehabilitation therapists to provide quality care for people with mental disabilities. But occupational therapists were excluded from the mental health specialist at the time of the enactment of the Mental Health Act. In 2008, the Korean Association of Occupational Therapists held the National Congress public hearings under the theme of Role of Occupational Therapists in Mental Health. In the same year, National Human Rights Commission reported lack of occupational therapy or lack of occupational therapy planning and evaluation in many mental health facilities. In 2010, the Korean Academy of Mental Health and Occupational Therapy launched and began to act as a task force for promoting the role of occupational therapists as mental health care specialists. At last, in the same year, a revised Mental Health Act that included occupational therapists as mental health care specialists was proposed by Ministry of Health and Welfare. However, this proposed bill did not pass the review and discussion process at the Congress. After experiencing blocks on the bill, the KOT had to change the strategies for public relations, working with not only government officials and senators, but also with appropriate professional groups, organizations, and relevant government and non-governmental organizations. Executive members of the KOT met with a joint association of mental health care specialist professions composed of nurses, psychologists, and social workers, and also met with representatives of the Association for Families of People with Mental Disorders to draw support for the need for occupational therapists to effectively treat mentally disabled people and help their return to community. Finally, in 2015, the Medical Service Technologists Act was revised to include mental dysfunction. In 2018, the National Human Rights Commission recommended to the Minister of Health and Welfare to consider sanctions for occupational therapy that was not provided by occupational therapists and cannot be seen for therapeutic purposes. In June 2018, WFOT President Marilyn Pattison wrote a letter to the National Assembly's Health and Welfare Committee supporting the inclusion of occupational therapists as mental health care specialist professions in the Mental Health Act, and helped to persuade lawmakers involved in amending the bill. On 28th February 2019, the National Assembly public hearings were held on the theme of what mental health services are needed to return to the community. On April 3rd, 2019, in celebration of the 50th anniversary of the acquisition of the first Korean occupational therapy license, the executive members of the WFOT and members of the National Assembly's Health and Welfare Committee once again appealed for the need for mental health occupational therapists. This is a keynote speech of Marilyn. And group pictures. And the executive members of the WFOT visited the National Center for the Mental Health. And this is a letter of appreciation from WFOT to National Center for Mental Health. The KOT then continued to meet with the National Assembly's Health and Welfare Committee and visit the Ministry of Health and Welfare's Mental Health Policy Department to assert the need for mental health occupational therapists. In this process, a member of National Assembly's Health and Welfare Committee became interested in the need for mental health occupational therapists by visiting the National Center for Mental Health. On 6 March 2020, revised Mental Health Act, which included occupational therapists as mental health care specialists, was finally approved by the Korea National Assembly. The Mental Health Act has finally ensured that occupational therapists are mental health care specialists. This is the letter of appreciation from KOT to WFOT. This table shows steady increase of practicing occupational therapists compared to other professions. It took more than 10 years to persuade the public, government, and Congress that occupational therapists could play a vital role in mental health care service. This can be attributed to many factors, including increased numbers of occupational therapists and educational programs. The evolution in the healthcare service environment from an acute care medical model to chronic disease biopsychosocial model, and endless strategic efforts by the Korean Association of Occupational Therapists. This presentation describes the cornerstones of occupational therapy bill changes and advocative actions related to mental health in Korea. Thank you very much for your attention.
Thank you, Dave, for an inspiring and informative presentation. Your story of advocacy in Korea highlights the incredible impact occupational therapists can have when they work collaboratively through their member organizations to influence policy. Now it's my pleasure to introduce our final speaker, Samantha Shan, WFOT President. Samantha will provide a global perspective on WFOT's important role in collaborating with member organizations. Her insights will tie together the key themes of today's session and inspire us to continue working collectively towards a sustainable and resilient workforce. Over to you, Samantha. Thank you.
Thank you, Richard, and thank you to everybody that's joined us today and is also watching later online for this really important topic. And as Richard says, I'm going to try and sum up some of the things that the speakers have also said previously, but maybe start to answer some of the questions which we will answer fully later on. So the World Federation of Occupational Therapists is the official international organisation for the occupational therapy profession, and we provide leadership and advocacy at high levels. Claudia showed earlier a number of organisations that we collaborate with, and that group of organisations is forever increasing. This collaboration is really, really important. It's making sure that occupational therapy is talked about at policy level, at regional and local level. Some of that work with the World Health Organization has been going on for many years. And where the global strategy for occupational therapy workforce really fits in is to complement some of that work. So we work very, very closely with the World Health Organization and the World Rehabilitation Alliance around advancing and promoting and advocating for rehabilitation. And there are lots of tools available from the World Health Organization, which WFOT has been part of in their development and also their authorization. But what we also need to ensure is that occupational therapy has its own voice. We need to make sure that as a profession, we are looking at our future and we are saying where occupational therapy should be and needs to be positioned. So WHO and WFOT tools complement each other. And I think one of the questions is also about classification and how occupational therapy is recognised. Is we have to have a strong workforce policy, a strong workforce strategy globally, but also regionally and nationally, to help with some of that classification and to help ensure that policymakers really understand the value of occupational therapy and our purpose as a profession. Some of these collaborative activities that we do are about statements, and as Claudia says, there are many statements. Some of them are interprofessional, some are from WFOT, but you can use those in your advocacy materials, but also like looking at some of the other collaboration partners that we have. A most recent one is with the International Committee of the Red Cross, and that's looking at how, again, we can make sure that occupational therapy is integrated in policy and service development ideas across the world. WFOT is a member organisation, and our member organisations are regional groups of occupational therapy, but more predominantly are national associations of countries. And right now we have 111 member organisations within WFOT. And again, reflecting some of your questions today and some of what the previous speakers said, is we have a real diversity within our membership in WFOT from high, middle and low resource settings. And the workforce strategy is really important to help us to move forward with what are the needs. Now, I think globally, we can all quite certainly say is there is a need for more occupational therapists. But how that actually looks and how we work at a policy level within each of our different countries is very different because the policies are different and the systems are different. So while the global strategy gives us this baseline, we then do need to start looking at what the local needs are and working with our member organisations. For WFOT, the strength of the profession in a country is that professional occupational therapy association. That national association is the member organisation of WFOT, so it gets that international partnerships, collaboration, access to the World Health Organization. But the national association is also the focal point for the profession in country, so the voice of occupational therapy in that country, acting on behalf of the profession, advocating for occupational therapy services, positions, education and research, maybe setting the professional codes of conduct and standards of practice with other agencies, and providing and nurturing the leaders and the future leaders of occupational therapy. So sometimes you will see, that support of WFOT, and as Claudia mentioned earlier, some of that support is done via emails, via letters, via online meetings. Some of it's in person, and that is to help to have face-to-face discussions with the National Association to talk around what are the strategic priorities to help them look at how they can position themselves, maybe to attend conferences so that they can engage their membership more and bring more members into their organisations, because numbers of members help to strengthen national organisations within country. But also by WFOT being in country, sometimes it allows those national associations to access government or officials that they may have had difficulty accessing meetings with. So, for example, recently in Pakistan, yes, WFOT was present at their first international conference, and that engaged with membership, but also enabled higher level discussions with the Higher Education Committee and Council to look at occupational therapy education in Pakistan. Another example being in Mongolia, where again there was a conference that helped engage occupational therapists and bring occupational therapists together to talk and debate, but it also allowed a meeting at Parliament and to be able to position occupational therapy within Mongolia, which predominantly at the moment is within paediatrics and children's services, and these discussions at higher government level were to be able to look at the broad depth of occupational therapy and to start that workforce planning of where occupational therapy needs to be positioned in the future, as well as doing podcasts and interviews on the radio to increase national awareness of the profession as well. So advocating for the profession is the role of the professional organisations. But as you saw on that first slide, is our professional organisations are at lots of different levels. Some organisations have been around for many, many years and have staff and have strong policies within their own countries. Some of our other member organisations are starting out and need that support from WFOT to look at leadership and advocacy activities. And that starting point is always working with the member organisations to help them to understand the health and rehabilitation needs in their countries, to start understanding the priority areas and be strategic of where can occupational therapy make the most impact. So as a profession, we must work together. We need to position ourselves wisely. We know, as occupational therapists, the depth and breadth that we offer, but sometimes positioning ourselves strategically with the governments, letting them know that we're willing to assist with achieving their health and wellbeing priorities, as well as sharing and promoting what occupational therapy is or can do to help meet country health, society and wellbeing needs and targets. So when we look at leadership, advocacy, policy for occupational therapy workforce planning, sometimes we need to start thinking a little bit out of the box. And by thinking and working strategically, sometimes differently, but always together, we do have the opportunity as a profession to shape our own future. Thank you very much.
Thank you, Samantha, for your important presentation in describing WFOT's role. I want to extend sincere thanks to all our speakers for their inspiring and thought-provoking contributions. Each presentation has provided us with valuable insights into how leadership, advocacy, and policy play crucial roles in shaping the future of the occupational therapy workforce. I hope today's session has inspired you to think about how you can contribute to this global effort, whether through leading advocacy initiatives in your own context, engaging with policymakers, and collaborating with your own member organisations. Thank you for joining us and for your active participation. And don't forget to stay connected with WFOT and access the resources that are available to support your interest and information. We will follow up with a webinar recording and respond to all the questions, Q&A questions and answers responses, and the additional materials soon. Thank you again for joining us today.